My name is Kina Leclerc and I will be...
Je m'appelle Kina Leclerc et je serai votre modératrice aujourd'hui.
Before we begin, I'd like to go over a few items. A reminder to place your phone on mute until I invite you to speak or to ask your question. And please do not place the call on hold. If you're watching from Rogers on the live feed or on YouTube, please ensure that your sound is turned down when you ask your question or muted when you unmute to ask your question. Available for questions from the media, we have, disponible pour des questions des médias, nous accueillons.
With us to answer questions for the media, we have
City Manager, Directeur Municipal Steve Kanellakos. On the line, we have Councillor Keith
Kanellakos, City Manager.
Conseiller Keith Egli, Président du Conseil de santé publique Ottawa.
Le conseiller Keith.
Medical Officer of Health, médecin, chef en santé publique. Anthony D.
Ottawa, Councillor Keith Egli, Chair of Ottawa Public Health Board.
On the line, we have John Manconi, General Manager, Transportation Service.
General Manager of Emergency and Protective Services.
On the line, we have Donna Gray,
Transportation Services Department Manager.
Socio et communautaire. On the line,
Community and Social Services Department.
I will quickly do a roll call to see which agencies are on.
Wendy Stephenson, Chief Financial Officer.
Je vais confirmer les noms des médias qui sont en attente. Mathieu Loca, 104.7 Cogeco.
Oui, bonjour.
Merci. Jason White, 1310 News.
It's Chris Curry's here.
Chris Curry's, thank you. Who do we have from CBC?
Joanne Canelo and Kate Porter. Thanks.
Thank you. Who do we have from CFRA? CFRA? Do we have Leah Larocque from CTV?
Yes, I'm here. Thank you.
Do we have Oliver Moore from the Globe and Mail? Okay. Do we have Julien Paquette from Le Droit?
Oui, présent.
Merci.
Yes, I'm here.
Here. Thank you. John Willing, Ottawa Citizen.
Hi, Kina.
Thank you. Pat Uguccione from Ottawa Community Voice. Thank you. Do we have Taylor Blewett from Ottawa Sun?
Liz Payne.
Sorry, was that you, Taylor? If you're not speaking, please put your phone on mute.
That's Liz. Liz Payne for the sign.
Thank you.
I'll need someone to put their phone on mute, please. Do we have Kenza? Est-ce qu'on a Kenza Beladi de...
Kenza Beladi, TVA. Yes, I'm here. Do you hear me? Yes, I do. Thank you.
Your phone's on mute if it is not your turn. Have I missed a news agency? Est-ce que j'ai manqué quelqu'un?
Oui, Frédéric Pepin, Radio-Canada.
Frédéric Lepère, Radio-Canada.
Okay, I will now invite each agency alphabetically. You may ask one question with a follow-up. Nous allons maintenant répondre aux questions des médias qui pourront poser une question et une question de suivi. So we'll now start with Mathieu Loca from 104.7 Cogeco. Mathieu, vas-y.
Oui, bonjour. Ma question.
Hello. My question is to the mayor or to anyone else. It's on finance. We saw a table of financial losses for the city projected until June, September, and December. How can you explain that we end up losing $272 million? How did you reach that figure? Thank you for the question. We lose $1 million a day. That's what we're losing at the City of Ottawa because we're lacking people traveling on OC Transpo, for example. There's been a drop of 70 or 75% in ridership on public transit. in people going to sports arenas and people going to the pools. We aren't running program activities, so that's a lot of money as well. As for building permits, the province has put an end to new housing construction, so we're losing money on that. And these are three major revenue streams, and therefore we've been losing money on them ever since the beginning of the pandemic, and we will continue losing money on them until September or whenever the ridership and other activities return to normal. Mathieu, do you have a follow-up? No, that's it. Thank you.
At 1310 News.
Yes, hi. This is a question for the mayor. We've heard there's not really much of a timeline for when RTG is ready to fix everything that's gone wrong with the Confederation line. Your thoughts on there being very minimal details presented today?
Well, look they sent us a report that's about 70 pages. Some of it we agree with. Others we're disappointed that they have not gone far enough in our mind to fix some of the fundamental problems that we've encountered over the last couple of months. And that's why, as part of the process, that we go back to them and we'll work with them. We talked today about a workshop that our staff and their staff will work with in collaboration to get these problems resolved. And I've let our staff know very clearly, and RTG, that this is the time, this period when we have reduced schedule, reduced passenger load during the pandemic, do everything they can to solve some of the root problems now while we have Saturday service up and running for the Confederation line. And I'll ask Steve Kanalakis to offer another comment as well.
Thank you, Mayor. Yeah, we always anticipated that we were going to have to get some clarification on what they submitted. As the Mayor said, it was a 70-page report. It's very detailed, and on some of the things that they have put forward that they need to address, they still haven't found root cause. So there's still some engineering work to do on some of those things. So now our technical team has to sit with them, which we always intended to do. That's not new, and clarify exactly what their approach is in some of these things so we can nail down some of the dates. Because at the end of the day, what we want to know is, as the Mayor said, is we want to know when we're going to be in a position to have a stable fleet, that ridership that the riders and the citizens of Ottawa can depend on.
Thank you.
Thank you. Do you have a follow-up, Chris?
No, thank you.
Thank you very much. We'll now move on to CBC. Who do we have from CBC for a question?
It's Joanne.
Go ahead, Joanne.
Hi. My question's for Dr. Etches. This is not, Dr. Etches, this was not in your presentation, but it is in the Ottawa Hospital presentations about possible deaths from COVID. It ranges anywhere from 200 if we have the most social distancing, up to 4,000 deaths by October, looking out to October. So I'm wondering if you can address those projections as well. Talk a little bit about the poll we're taking, like how do we know that 70% of us or more are social distancing, or I don't want to put words in your mouth, but if you can talk about those two things from your presentation this morning. Thank you.
Yes, thank you. The Ottawa Hospital modeling, in collaboration with our epidemiologists, is very useful for scenario planning to test out what happens under certain conditions into the future. I believe Dr. Doug Manuel said it's also a little bit like predicting the weather, that the closer you are in time to that prediction happening, the more accurate that is. And so it's harder to be certain about the numbers going out many months. But that data is based on what we're currently seeing on the hospitalizations currently happening. So it's a bit more robust than being based on just the laboratory tests that are happening. And so that is assisting with the planning of the healthcare system response. When you look at the models, they all show that social distance or the physical distancing, keeping 2 meters apart is really effective and it's really important. And especially if we can make sure we're decreasing our interactions with other people by more than 70%. And so the data we have so far on that comes from an ECOS poll that we did a week ago in Ottawa. Was online, it was random, and so we can say that 85% of people are working to stay 2 meters away from people as much as possible. So that's a data source we have. We're planning to repeat that, in the coming weeks or so, to be able to have a look at the trends over time and to be able to, explore further. That information, the full report on the ECOS poll will be also made public as soon as we can get the report finalized.
Thank you. Joanne or Kate from CBC, do you have a follow-up?
Yes, I had a question for Mr. Kanellakis, I believe that it would be. That's to do with the gap, if it's predominantly or at least more than half due to a big drop in transit ridership and fares. I just wanted to check what ridership number we would be using now, because we had been speaking about 70 to 90%, but also just what is the status of the drivers, because that one would assume, they're being paid wages, but if they're responsible, not they, but the department is responsible, for the biggest lack of revenues, what happens with them and what's their current status?
Thank you, Joanne. Our ridership is down over 80% right now, from what I understand the latest figures are. And so, yes, that's a big chunk of our daily revenue that we're experiencing. Right now, we do have drivers who, operators and staff who, because we have the reduced schedule, who aren't having regular schedules. OC Transpo under Mr. Manconi are reviewing the current situation in terms of forecasting when we're going to need the operators back and when we start moving back to a more normal service. As I said in the council meeting today, we're evaluating all those things over the next couple of weeks, because we don't want to be rash and we want to do our due diligence to make sure that we're not making hasty decisions about the timing of when people come back and making sure that our employees are available. We are worried about our operators that are on the routes right now, because they could get sick, and we're starting to see some absenteeism for a whole variety of reasons. We don't want to deplete our operator core. We need to keep them and our fleet people and our maintenance people and all the things that have to keep going to keep the fleet available, so that we don't end up losing our certifications from MTO, etc. And so we're trying to keep this balancing act of, we're paying some people who aren't doing a full job right now, but we also need reserve troops, and we can't have a reliance on just who's actually working right now, because we fully expect that we're going to start losing people as the weeks go by, and we need people to be able to jump in and fill those seats.
Thank you. We'll now move on to CTV. Leah Larocque or Josh Pringle?
Hi, it's Josh. Question for Dr. Etches. Can Ottawa Public Health right now say when we may see a peak in the pandemic and the number of cases based on the data that you presented today?
I appreciate people want to know when we'll be seeing the worst is behind us in terms of the increasing cases. The data presented today is not really sufficient to accurately predict when we'll see that peak. And I say that because the first type of information, the model that was presented, is based on current testing patterns, and we are aiming to increase our testing. We are opening up testing beyond healthcare workers to look at things like those who live with a healthcare worker, to extend more into other types of essential service workers like grocery store workers. And so as we test more, the model based on testing is going to shift, and we expect that curve to shift. So we can't be sure about a peak based on that type of data. The other data about when will we peak in the models from the Ottawa Hospital show that it's completely dependent on how well we practice physical distancing. And so it's really up to us, how well we continue to keep 2 meters from others will push off the peak, but it will allow us that time to make sure that we're ready as a community, that we have the things in place to then start to ease up on physical distancing. And the last source of data that I mentioned today was the London School of Tropical Medicine. It wasn't in the slides, but using death data to tell us about how many cases might be in the community. Again, it doesn't predict the future. It's based on death. So what I am looking at to be able to know when we are past a peak of illness would be some of the outcomes like hospitalization and death. When I start to see hospitalization numbers and the numbers of deaths decrease, that is when I think we'll be starting to think about how do we safely ease up on some of these measures. And unfortunately, we're not seeing that yet. The number of hospitalizations and death is still growing.
Thank you. My follow-up question, just people are wondering why there is a discrepancy between the 429 confirmed cases that were announced today and the estimate of 11,000 to 34,000. Can you explain how the modeling sort of gets to that number that there could be that many cases in Ottawa?
Oh, dear.
Can you please take us off the, okay, thank you. Please, a reminder to not put us on hold, but put us on mute. Thank you.
So the numbers that we count and we show as a line and a curve on our website are based on laboratory confirmed tests. And I've said all along that is a very small picture of the infection in our community because we don't have the capacity to test anyone who doesn't fall into a priority group right now. And so there are people with respiratory illness in the community. It could be COVID-19, it might not be. And we're looking at ways to count that. We're looking at ways to determine how much of that is COVID-19, but we don't have a definitive answer yet. And so the other ways we can try to estimate the amount of illness in the community are to look back from death. So that 11,000 to 34,000 is actually the maximum, that's the range of the maximum number of infections that we would expect based on seeing 6 or 7 deaths to date.
Thank you.
Thank you. We'll now move on to Oliver Moore from Globe and Mail, if you're on the line. We'll now move to Julien Paquette à Le Droit. Julien, vas-y.
Oui, bonjour. Good afternoon. I'd like to have more information regarding the measures implemented in emergency rooms for the elderly or the disabled. We had cases of complete confinement in their bedroom or their housing units. But how are we preparing to avoid another explosion of cases? Well, maybe I didn't understand your question completely. It was regarding the number of cases in the population, the elderly population. Well, what is being done to avoid another outbreak and a transmission of the virus in senior residences that are managed by the city? Regarding the outbreaks, there are more of those in the long-term care facilities. It's true. We have all the details with the names of the institutions on our website, but the number of confirmed cases in outbreaks are not really high. The definition of an outbreak in an institution is one case in one of these centers, or one worker or one resident. So the most serious situation where there's been 3 deaths is in Le Promenade d'Orléans. And in the other cases, we don't have any deaths. Does that answer your question? No, actually, I wanted information on the measures that you've put in place. What would you do to avoid, what do you do to avoid any transmission in the institutions that are managed by the city where there was not an outbreak yet? What should these people do to avoid an outbreak? Oh, that's an important question. Of course, we have to prevent the infection in these units. It's a priority for all the health workers. So we are we're preventing anyone sick to work in these institutions, and we recommend that all workers wear masks and the personal protection equipment if there is enough. So that's a priority. There's also regulations regarding visitors. I mean, there some institutions limit the visitation, and we are working with the measures to be implemented for cleaning, to keep people apart in these residences, to avoid contact with people as much as possible in these centers. So there are many measures that can help minimize the transmission or the infection rate. Did you have a follow-up question? Yes, a question for Mr. Mayor. How do you feel about what we heard today regarding the RTG's answer following your notice? The answer to this very serious situation is not very satisfactory. Yes, we are disappointed with some answers in the RTG letter. Because we still have problems and challenges with the system, that's why we're not paying RTG. The client is not satisfied, and this is why we now it's our turn to answer RTG, and we told them that it was necessary to have more improvements on very serious issues that we've been stuck with for 6 to 8 months. So we're continuing to work with RTG, but it is a serious situation. We've seen some improvements during the last few weeks because there are not very many users right now. So as I said a few minutes ago, it's a good time for RTG to continue to improve the systems, the rail system and the computer system. Because there's 70% less users right now. So it's a good time. There are less trains in the system now, so it's the perfect time to correct the major issues. They propose an action plan today, but our staff must continue to push RTG so that they accelerate the improvements, because it's a crucial element of the system.
Sorry about that. Just had to find my mute button. I'm wondering, for the Riverside campus of the Orleans Hospital, is there any capacity there to bring rooms online?
Thank you. The healthcare sector is working under a Champlain region-wide COVID response table, and they are looking at all of their options that they have to increase the number of beds available for critical care, especially, as well as innovative approaches for people who don't need that level of hospital care in the community. And so if people have ideas for different facilities that could be used by the healthcare sector, people are accepting those ideas and those offers. The most feasible way to start, and people have been working on this, is to build capacity within the existing structures. But all ideas are welcome as they work forward.
Okay, as a follow-up, I'm asking this question sort of on behalf of the community newspapers here in Ottawa. Can we expect any other additional paid messaging from OPH or the city for papers for next week, considering that a lot of our readers are seniors that don't have access to Instagram or Facebook or even the internet?
Yes, we did a mail out to every household with the key information exactly for that reason. We know that not everyone accesses a variety of digital media, and so the mail out conveyed the most important things we want people to do is know to self-isolate when they're sick and know that the physical distancing measures are important for everyone. If there is a significant update, we can certainly consider another mailing. And we are working through other channels that will reach seniors. So we have a network of organizations that work with seniors. And we are, it's really the city is leading the Human Needs Task Force that is thinking about isolated seniors. And we will be actively going out also to try to share information. So we'll use any tool we need to if there's important information to get out.
If I could just add to that, Fred, I was just talking to Steve Kanalakis. We're going to try to do our best to get some advertising into some of the print publications, in particular the community newspapers, because we know that you're struggling as well, and we don't want to see these voices lost. You know, I'm concerned when I see the obviously Le Droit went back to one edition a week, and then the Citizen and the Sun are quite thin because, you know, the stores that normally would advertise and the businesses are not there. So we're going to try to see what we can do. We have obviously limited capacity ourselves, but I think it's a good way to get to those people who traditionally do not go on social media and don't have computer access. So the city manager has indicated that he'll take that away and see if we can't get some ads in that deal with the messaging and maybe co-sponsor with public health and get back to you as quickly as possible, because I know time is of the essence in terms of the survivability of some of these publications. Thank you.
That's great. Thanks very much, Jim.
Thank you. We'll move on to John Willing at the Ottawa Citizen.
Hi, Mayor. We heard from, the city treasurer today that the city could ask for changes to provincial laws governing municipal budgeting. One of the ideas was to find ways to generate other revenue for municipalities. What are your thoughts on that? And do you see any areas in municipal services where this you think could be applied?
I'll actually, because Steve is chairing that committee on finances, John, obviously every municipality in the province, all 444 of us, are dealing with the same challenges, a bigger magnitude in a city like Toronto or Ottawa versus a small community. But, as you know, we're not able to, by provincial law, run a deficit. So we have to find ways to make ourselves whole by the end of every fiscal year, which is December 31st. In terms of other revenue tools, I know a number of items are being looked at. Nothing's been decided at this point, but we have limitations, obviously, in terms of what we can do. It's, some people have said, well, just, raise property taxes 10%. Well, that then hurts the same people who have been struggling for the last couple of weeks to make ends meet, and that doesn't really accomplish a whole lot. So, Steve, I don't know if you wanted to talk about the finance table and what we're looking at.
Yeah, Wendy, are you on the line by any chance?
Yes, I'm here, Steve.
Yeah, so you had mentioned some of the options, because, and I'll turn it over, John, to Wendy in a second, but all these things are being discussed with cities across Ontario for sure, and Wendy's in that network, and Wendy's chairing one of the tables that reports into the group that I chair. Basically, finance is one of the three areas we're really focusing on across the whole city. And there's all the municipalities in Ontario now are looking at different innovative ways to try and defer some of the pain that we're having right now, or to get some funding to help us out. And that's happening. I just want to give you some perspective across the country. Every city is looking at how to deal with the pressures they're under by finding innovative tools to give them some relief before they have to deal with some of the pressures that are coming back to them. So Wendy, maybe you want to repeat I think you mentioned 2-3 things that we were looking at that the treasurers were talking about at your table.
Sure. Thank you, Steve. I think one of the things that we want to talk about with the province is terms of the restricted use of some of our reserves. So that's very legislated and regulated, so that's a conversation that we want to have in terms of how we can leverage some of the money that we have already within, I'm going to say, our bank accounts. One of the issues that was raised, Steve talked about the table that we have across Canada and across the province, is a program that works out of BC where the provincial government backstops folks who can't afford to pay for property taxes or water. And they provide that money to the municipality, so it's additional arm or revenue to the city to help us run. And as the mayor says, we do want to explore other opportunities, but whatever we do, we want to make sure that we're stimulating the economy and that we're not affecting anybody that has been hit by the COVID.
Thank you. Do you have a follow-up, John, or was that your follow-up?
No, just another question to Steve Kanalakis. Steve, correct me if I heard this wrong, but you talked about possibly redeploying 1,000 staff to OPH. And I'm wondering how would that be done, and what kind of work would you foresee those workers be doing for the health unit?
Well, I'll answer the first part in terms of how that's being done, and then I'll turn it over to Dr. Etches in terms of what the need is for those employees and the pace of which she would absorb that workforce into her own workforce. Right now, what we're doing, John, is we have a team under emergency management protocol that we have here at the city, our emergency operations control group, which includes all the general managers, the fire chief, police chief, paramedic chief, Dr. Etches, the CEO of the library. We meet daily, and one of the way we're structured is we have task tables, task teams that drive certain things that we want outcomes for. And we have a task table right now that's looking at the redeployment of staff, working with the unions. What they're doing is identifying all staff in every department who is now not in a position to be able to fulfill their primary role or has capacity to do another role. And then we're identifying all the jobs or roles or functions that we need performed in the city and in the community over the next period of time. And then the process starts of matching the people with capacity and their skills with the need that we have in the organization, the community, and seeing if we can get some good matches across all departments. So the first step is each department is redeploying within their own department to meet their own immediate service needs, and that happens for all 9 city departments, functional areas. The second priority is what staff can we pull out of departments and move to other departments. And the third priority is what staff immediately have to be moved to deal with the increasing demands that have overtaken the current staffing of city services. And public health is one of those areas. Community and social services is one of those areas where we know that we need to get people moved over there to help them with what they're dealing with. And I'll ask Dr. Etches to speak particularly about what her need is in public health.
Thank you. Yes, the type of work that we are focused on, besides communicating to the public and doing the surveillance and looking at the data, is answering questions of the public, so helping healthcare workers and members of the broader public understand what the guidance is, address their questions. But the big volume of work that will continue to grow is what we call case and contact management. We have specialized skilled nurses that do a lot of this work, and we're thinking about how others can help. So we've been growing that team with nursing, people from other parts of the city, from medical students, all kinds of people who can help. What we have to do for every laboratory confirmed case is do a detailed interview about all of their activities when they could have been infectious, and then follow up with any contacts. And sometimes that's routine, and sometimes there aren't too many contacts, but sometimes it's very resource intensive in terms of working with a workplace or on an outbreak. And so again, that outbreak team also, unfortunately, we wish it wasn't this way, but it is also needing to increase their complement as we have more outbreaks to work on and assist facilities to prevent and then contain them. So we are managing with the additional hiring that we've been doing. We see the number of cases are going up, doubling every 4 or 5 days now. So we're trying to double our team in parallel, as well as look at other ways of doing that work. So can we use digital tools, apps, all kinds of ideas are being explored. Part of the work that could be done by folks who may not have the same specialized training would be things like data entry or follow-up to check in on people who are cases or contacts, because we do like to keep in touch with people during their period of self-isolation to make sure that they're well and they're getting the support that they need. So that work will continue to grow as we increase the number of people we can test, which is our objective.